Welcome to this week's edition of Cardiovascular Updates, covering the latest breakthroughs. Brought to you by LucidQuest. We begin with highlights from ACC 25, where DCRI faculty emphasized innovation in heart failure diagnostics and artificial intelligence. Discussions included living AI ecosystems, transparent oversight in regulatory pathways, and new strategies for fluid management, particularly in older adults. New data links hearing impairment to heart failure risk. People with poor hearing may face up to a 28% higher risk of heart failure. Researchers suggest that social isolation and psychological distress may mediate this association, proposing hearing ability as a potential early indicator of vascular health. A smart shirt developed at the University of Illinois is making headlines in wearable tech. This shirt monitors heart rate recovery post-exercise to predict early signs of cardiovascular disease. The technology opens new avenues for remote, continuous heart health monitoring. In cardiac surgery, 4-factor prothrombin complex concentrate, or 4-FPCC, is showing superiority over frozen plasma. Patients receiving 4-FPCC needed 44% fewer interventions, with reductions in bleeding, transfusions, and adverse events. It also offers faster, more universally applicable treatment. At 5 years, fractional flow reserve-guided PCI demonstrates comparable outcomes to CABG, according to the FAME-3 trial. Death and stroke rates were equivalent, although PCI patients experienced more myocardial infarctions and reinterventions. The results reflect improvements in stent technology and medical therapy adherence. Oral semaglutide significantly reduces cardiovascular risk in type 2 diabetes, according to the SOUL trial. A 14% reduction in major adverse cardiovascular events was observed. This benefit occurred regardless of whether patients were also taking SGLT2 inhibitors, highlighting semaglutide's broad utility in risk management. Cardiac MRI is enhancing risk prediction in patients with connective tissue disease-associated pulmonary arterial hypertension. When combined with the Compara 2.0 model, MRI metrics like interventricular septal extracellular volume and right ventricular ejection fraction more accurately stratify patients and guide treatment. New research highlights rural-urban disparities in cardiometabolic risk. Rural populations show higher rates of hypertension, diabetes, and obesity. These differences are driven by social determinants such as poverty, limited healthcare access, and educational inequality, pointing to the need for targeted public health interventions. Gene therapy is advancing with promising results. Verve 102, a base editing therapy targeting PCSK9, reduced LDL cholesterol by 69% in some patients, with an average reduction of 53% following a single dose. No serious side effects were reported. Phase 2 trials are expected in late 2025. At UVA Health, researchers are testing lepidosiran, a drug designed to lower lipoprotein A, an underaddressed cardiovascular risk factor. Early data are encouraging, offering potential for individuals with elevated lipoprotein A despite normal LDL levels. However, additional studies are needed to confirm efficacy. Finally, Emory University has initiated enrollment for a Phase 3 trial using autologous cell therapy in patients with ischemic heart failure. The BioCardia platform aims to improve heart function and reduce fibrosis. Backed by CMS and the Maryland Stem Cell Research Fund, trial completion is targeted for 2027. Stay ahead in cardiovascular research. Like, share, and subscribe for weekly updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.